What is norovirus?
So norovirus is a particular type of stomach bug. It is a virus, and people usually catch it the same way that they catch the other stomach bugs, which is by touching dirty surfaces or eating dirty foods.
Okay. And how contagious is it?
So norovirus is extremely contagious. It's one of the most contagious infections on the planet. It takes a very little bit of virus for an infection to get established. It lasts a long time when it touches surfaces, and it spreads really easily from person to person.
Is that maybe why we're seeing a spike? Because the holidays just wrapped up and people were around more people than they're used to?
It's certainly possible. It's really easy for norovirus to get a foothold in populations that are clustered together. That's why we see it often on cruise ships and army barracks and schools and places like that.
Okay, and so what are the symptoms? What should people be looking out for?
So the hallmark of norovirus infection is diarrhea. That's usually the worst symptom. Most people will also get some vomiting and belly pain. Maybe half of people will get a fever as well, and it's not uncommon to have headache and muscle aches alongside that. It can feel like the flu, where the GI symptoms are particularly bad.
Okay, and do you need to go to the doctor or when should you go to the doctor?
So, most people with a mild infection don't need to see their doctor. If you just have a little bit of diarrhea or a couple of episodes of vomiting and otherwise you've been able to drink liquids okay and stay hydrated, that's all right to watch at home. But if you're worried that you're getting really dehydrated, you can't keep any liquids down, or you're just losing so much liquids that you can't keep up, then that's probably the time to get seen.
Okay, and what can people do to prevent from catching it?
So, really, the best thing that you can do to try and prevent from getting a norovirus infection is to make sure that everyone around you is washing their hands really thoroughly and that you're cleaning any surfaces that someone with norovirus may have come into contact with. So, if there's anyone at home who has diarrhea, then make sure that you're keeping everything very clean and don't share any food or drinks with them. It can be difficult when we talk about food at restaurants and things like that, food prepared by people you don't know, because you can catch norovirus from them. But I think if you're making sure that you're keeping yourself clean and practicing good hygiene, then you're going to go a long way from getting infected.
Okay, perfect. And then finally, I forgot to ask you this. What healthcare system are you with?
Oh, I'm with Christus Children's in downtown San Antonio.
Okay, perfect. Is there anything else that I haven't asked you that you think is important for people to hear?
No, I think that we've really covered it. The most important thing is if someone with a bad stomach bug is getting dehydrated, they need to come and get seen.